All right, welcome to another deep dive. This time, we're going to examine a patient with an abdominal renal transplant. We've got the medical records and exam notes right here.
Oh, this is fascinating stuff. Really is. It's like piecing together a puzzle. You can learn so much about a patient just from a physical exam.
It really is like you can almost read their medical history just by looking, right?
Exactly. It's like their medical autobiography written on their body, in a way.
Okay, so let's jump right in. The first thing that really caught my eye in these notes was this prominent, like J-shaped scar. It says right here on the abdomen.
Ah, yeah, the classic renal transplant scar.
And then right under that scar, there's this palpable mass.
Yep. And that tells us right away that this patient's transplant is functioning. It means they're no longer dependent on dialysis.
So it's not just the scar itself, but actually being able to feel that mass underneath that confirms the kidney is working.
That's right.
Wow, that's so interesting. Okay, but then there's this other detail um, about an AV fistula
Hmm.
in the left arm, and it mentions a palpable thrill too. What exactly does that tell us about this patient's history?
Well, that AV fistula is a pretty clear sign that they were previously on hemodialysis. It's basically a lifeline for patients with kidney failure.
Right, because it allows their blood to be filtered outside of the body, right?
Exactly.
And by checking for recent needle marks around the fistula, we can even tell if it's still being used.
Absolutely. You can actually get a sense of how long they might have been on dialysis before receiving the transplant just from those little details.
Oh, wow. It really is like piecing together a timeline, huh? Like each clue reveals another part of their story.
Absolutely. It's like detective work.
Okay, so we've got this functioning transplant, evidence of past dialysis.
Mm.
It's amazing how much we can already tell. Oh, and the notes mentioned something about a couple of abdominal scars. At first, they thought it might be from peritoneal dialysis.
Right, but it turns out those scars were actually from an umbilical hernia repair and a persistent postoperative drain. Just wouldn't quit, apparently.
Wow, so even in a physical exam, there can be these, like, little plot twists.
Oh, definitely. And that's why it's so important to keep an open mind and consider every possibility.
It's a good reminder that not all scars tell the story you initially expect.
That's for sure.
Okay, so now let's dive into the reason behind the kidney failure in the first place. The notes mention bilateral masses in the patient's loins, which led to a diagnosis of autosomal dominant polycystic kidney disease.
What exactly is that? I mean, for our listener who may not be familiar.
So basically, in this case, it means you've inherited a gene that causes these cysts to grow in the kidneys. As time goes on, those cysts, they multiply and they start to interfere with how the kidneys function, eventually leading to kidney failure.
So it's like this, almost like a ticking time bomb within their genes.
In a way, yes.
Wow. Are there other common causes of kidney failure besides this genetic condition?
Oh, definitely. High blood pressure is a big one, and diabetes. Those are both major culprits. And then there are various forms of what's called glomerulonephritis.
Glomerulonephritis. Yeah, which is essentially inflammation in the tiny filtering units of the kidneys. So many different paths to kidney failure, really.
Right. It's not just one thing, but this whole web of interconnected factors.
Exactly.
So when does the conversation about transplantation typically happen? I mean, when do doctors start preparing patients for that possibility?
Well, ideally, we want to start talking about it well before dialysis even becomes necessary. Patients who are approaching end-stage renal failure, meaning their kidneys are functioning at less than 15%, should be evaluated for a transplant.
So the earlier the better, it sounds like.
Definitely.
But are there cases where a transplant might not be an option?
Oh, for sure. Finding a compatible donor is a major hurdle.
Right.
It's not as simple as just, getting a kidney from anyone. It's like finding a perfect puzzle piece, one that fits your unique immune system.
Right. It's not a one-size-fits-all situation.
Nope. And then there are medical conditions that might make a transplant too risky, like, say, if a patient's had a recent cancer diagnosis or has an active infection, even severe obesity can complicate things.
So it's this delicate balancing act, weighing the risks and benefits for each individual.
Exactly.
And even when a transplant is successful, there's the long-term challenge of immunosuppression, right? Like these medications. And I keep thinking back to those scars we were talking about.
Yeah, that's a really important point. Immunosuppression is kind of a double-edged sword. You need it to prevent the body from rejecting the new organ, but it also leaves the patient more vulnerable to infections and even certain types of cancer.
So it's like they get this new chance at life, but then have to constantly be on guard against their own body turning against them.
That's a good way to put it.
Wow, it really makes you appreciate the complexity of transplantation. It's not just about the surgery itself, but all of the long-term management and care that goes into it.
Exactly. It's a lifelong journey, really. And speaking of the long term, we have to talk about the specific challenges of those immunosuppressant drugs. Life savers they are, but they don't come without a price.
Yeah, it's wild to think about how your body has to kind of adjust to these powerful medications. We were just talking about some of the side effects, and it makes you wonder how patients manage them, you know, day after day.
It's definitely a huge adjustment. Remember when we were talking about cyclosporine earlier and how it can cause that gum overgrowth?
Uh,
Can you imagine dealing with that? On top of everything else, it's got to be uncomfortable to eat and it can even mess with your oral health.
right, it's like this added layer of challenges on top of this already monumental thing they're going through.
It really is. And that's just one example, right? Like tacrolimus can cause tremors, which can make it hard to do even basic things.
Oh, right.
It's like your own body is working against you, even when you're celebrating this second chance.
I bet that's incredibly frustrating for patients, especially after waiting so long for a transplant. They finally get this gift of life, and then bam, they have to deal with these new obstacles.
It's true. That's why it's so important to keep a close eye on things and manage those side effects really carefully. It's all about finding that balance, enough of the medication to prevent rejection, but not so much that it causes a whole bunch of other
Like
problems.
a constant balancing act.
Exactly.
So what stands out to you about this particular patient's case? How do their medical records show us that balancing act in action?
Well, it says here that the patient had some tremors right after they started taking the tacrolimus, so they had to carefully adjust the dosage to find that sweet spot where the tremors went away, but the risk of rejection was still low.
So each case is different, and it takes time to get things right.
Absolutely. Every patient is unique.
It really emphasizes how crucial that patient-doctor relationship is. That open communication is so important, especially when it comes to these complex decisions.
Couldn't agree more. Patients need to feel comfortable talking about their concerns and being an active part of their care.
Right, it's a partnership.
Yeah.
Okay, so we've talked about the physical challenges, but there's a whole other side to this too, right? The mental and emotional impact of transplantation, it's got to be a roller coaster.
Oh, it totally is. You have the initial excitement of receiving a life-saving organ,
Yeah.
but then there's the fear of rejection, the uncertainty. It's a lot to deal with emotionally.
I can imagine there's probably even some guilt mixed in there, especially for patients who received an organ from a deceased donor.
That's a very real thing. We can't forget that organ donation is an incredible act of generosity.
Right.
The donor's family makes this selfless choice in a time of tremendous grief, and that weighs heavily on a lot of recipients.
Yeah, it really underscores the human side of all of this, the compassion and selflessness woven into organ transplantation.
Absolutely.
And processing those feelings takes time
Right.
and support.
Of course. That's why support groups and mental health services are so important for transplant recipients. They provide a safe space to connect with others who understand what they're going through.
Yeah, it's about taking care of the whole person, not just the physical part.
Exactly. Transplantation is about giving someone a second chance at life, which means taking care of their mental and emotional well-being, too.
You know, it's amazing how interconnected everything is when it comes to transplantation. The physical aspects, the emotional side, the ethics. It's a lot. But I'm curious, while we've been talking about all the complexities of life after a transplant, is there anything we can do to, like, avoid needing one in the first place?
That's a fantastic question, and it brings us to a really important part of this deep dive, the power of prevention. Remember when we talked about high blood pressure and diabetes and glomerulonephritis, all those things that can lead to kidney failure?
Oh, yeah, for sure. It's like
Yeah.
if you know your enemy, you can fight back, right?
Exactly. If we can manage those conditions well and early on, we can really lower the chances of them turning into end-stage renal failure. It's all about being proactive, taking care of those kidneys.
So it's not just about treating kidney disease that's already there, but actually preventing it from happening.
You got it. And that takes a multi-pronged approach, so to speak. We're talking lifestyle changes, taking your medications as prescribed, and regular monitoring. It's like a three-part strategy for keeping those kidneys healthy.
Okay, let's break that down a little. What kind of lifestyle changes can really make a difference?
Well, diet is huge. You got to think of your kidneys like these little filters, working hard to clean your blood all the time. Eating a diet that's low in sodium and saturated fat really helps those filters run smoothly, helps keep that blood pressure down, and reduces the strain on your kidneys.
So it's like you're giving your kidneys the best possible
Mhm.
fuel, right?
Yeah.
To keep them in tip-top shape.
Exactly. And just like a car needs regular maintenance, Our bodies need exercise. Being physically active helps keep those blood sugar levels in check, which is super important for preventing diabetes. And we know diabetes is a big risk factor for kidney disease.
Right.
Plus, exercise helps your heart, and a healthy heart means less stress on the kidneys.
So it's this whole holistic approach, like what's
Mhm.
good for your heart is good for your kidneys and vice versa.
You nailed it. Now, the next thing is medication adherence. A lot of folks with high blood pressure or diabetes need to be on medication to keep those conditions under control. I know it's easy to forget to take a pill every day, especially if you're feeling fine, but consistency is key.
Right. It's about understanding that skipping even 1 or 2 doses can have a real impact. It's like you're undoing all that good work.
That's exactly right.
Yeah.
It's a team effort between the patient and their doctor, working together to manage things. And the final piece of the puzzle, regular monitoring. Anyone with kidney disease, even if it's in the early stages, needs to get their kidney function checked out on a regular basis.
So we're talking about being proactive, catching any potential problems before they get worse.
Absolutely. Regular blood and urine tests can pick up on even subtle changes, which means you can intervene early and make adjustments if you need to. Think of it like getting your oil changed.
It's preventative maintenance for your kidneys. And, this whole focus on prevention actually ties back to what we were talking about earlier, about the ethics of transplantation.
Oh, absolutely. If we can prevent kidney failure in the first place, then we can reduce the need for transplants, right? Which means those organs can go to people who need them the most.
It's like this ripple effect, where our own choices can have a big impact on others.
Exactly. That's why things like public health initiatives are so important. Spreading the word about kidney disease, encouraging people to make healthy choices. It takes a village, really.
Well, this has been incredibly eye-opening. I feel like I have a whole new understanding of transplantation. It's not just about the surgery, but about understanding how our choices, our health, and the ethics of healthcare are all intertwined.
That's a wonderful takeaway. And at the end of the day, what we really want is a world where fewer people even need transplants because we've all become so good at preventing kidney failure in the first place.
That's a really powerful vision.
It is. And remember, knowledge is power. When we understand how to protect our kidneys, we can make good choices for ourselves and help advocate for others.
Thank you so much for taking the time to guide us through this amazing deep dive. I've learned so much.
You're so welcome. I'm glad you found it valuable. Stay curious and keep learning, everyone.